Alrighty, so we are doing an upper blepharoplasty. This is Dr. Patino here at the Cosmetic Surgical Center of Osarito. But notice how we do this. I just cut with a knife, complete absence of bleeding. Thank you. So basically now what we're doing is we're just removing this excess skin from here, right? And look at this, incredible, see? At the same time, while we're removing the excess skin, we're electrocoagulating. So there is absolutely no bleeding when we do this here at the Cosmetic Surgical Center of Osarito. So this usually, leads to bleeding, significant bleeding. So where all this is like, red and everything. But here what we do is we're charcoaling everything. And we do this in a completely, in surgery we say dry as a bone, right? Dry as a bone surgery where there is no bleeding, right? And here in the eyelids is very important that there is no bleeding. Well, everywhere is important, but especially here because any bleeding here can lead to any pressure on the optic nerve and then can cause blindness. And so we never had bleeding, thanks to God. We never had anybody go blind, thanks to God, and we want to keep it that way. Thank you. All right, so look how clean this surgery is, right? I mean, it's incredible. This is just beautiful, beautiful surgery here at the Cosmetic Surgical Center of Osarito. You're getting a real good close-up here. So you can see and usually here at the end, I usually use scissors, but look at that. That's the excess skin. It charcoaled down and it shrunk, you see, because of it's like putting charcoal, but that's the excess skin. We took it out. Thank you. All right, so notice how dry this field is. There's absolutely no bleeding, and these are the nasal fat pads on the upper eyelids, and we're just gonna go ahead and excise it. So go ahead and do some retraction there, and we're gonna put in order to cover the eyelid, I'm gonna put a Q-tip right under it, right? And so we're gonna go ahead and remove this nasal fat pad, but it's gonna go into I'm gonna cut right into the Q-tip so that we protect the eyelid, right? Thank you. So this pink structure here is the orbicularis muscle. It's a muscle that goes around the eye. And with blepharoplasty, the traditional technique for the upper eyelid surgery calls for the excision or removal. You cut it out, that muscle, right? But instead of doing that, what we're doing is we're charcoaling it. You see how this is like a barbecue, and what happens is that when you cut this muscle, you see how it's blue because it's got a lot of like blood vessels too, right? But here, when you cut it, it will bleed, and then that's gonna give you obviously bruising and swelling. But this technique is very atraumatic, and not only that, but completely bloodless, see? And that's important. So if you would like to have a procedure like this, please give us a call here at the Cosmetic Surgical Center of Osarito. Beautiful surgery. Look at that. Completely bloodless. Thank you. In this case, this is the nasal fat pad on the other side. It's a little bigger, and you don't have to take everything out. There's a blood vessel here that I want to electrocoagulate right at the base, right? Because we don't want any bleeding here. So what we're gonna do basically is gonna do the same thing. We're gonna put it under a Q-tip, right? And then I'm gonna cut right onto the Q-tip. So you don't have to take all this fat out. You just take it off so that she has a good result. So good aesthetics. And again, I'm cutting right into the Q-tip. This patient is under general anesthetic. And this is how we do it. Thank you. And that pink structure right there is the orbicularis muscle. And instead of cutting it and causing bleeding, and swelling and bruising, what we're gonna do is what we did on the other side. We electrocoagulated we charcoal that area. You see how it's getting contracted, right? And so that way, basically, what we're doing is we're doing the job, but in a less traumatic manner, and much better for the patient, much better recovery. This is completely bloodless, you know. This patient was very apprehensive about the IV because she has doesn't really have very good veins, you know, so she was very nervous about that. But look at this. We spill more blood on put in the IV than doing this. Incredible. Thank you. Alrighty, so look at this. So this is also a nice technique to do the suture, right? So you'll see how we take these sutures out. It's almost like magic, man, because there is no knots on these sutures, right? And I just pull them out. You can go to YouTube and put upper eyelid suture removal by Dr. Gabriel Patino, and you can see how incredible, painless. Normally when sutures are taken out and this area is so tiny, right? You need like how do you call it, loops, you know, magnifying glass to see, you know, and it may take some time, you know, to do it. 15, even maybe even 30 minutes to do this, right? To take him out. We're taking out within seconds, basically. Almost like magical. But notice the complete absence of bleeding when we do this here at the Cosmetic Surgical Center of 03. Like I said, this is super important for the patient. That's why our patients the next day, they don't have any significant bruising or swelling or bleeding, right? And the eyelids, like I said, is super important. In medicine, we say this is dry as a bone. Dry as a bone. Can you tell how dry that is? Not even a drop of blood, you guys. This is just unbelievable. And you may think that we choose our cases and we show you just the best. No. All our patients are like this. Right, Emily?
Correct.
Pretty incredible, right?
Oh, yes.
Look at that. And so we're closing without any tension. So the edges are not bunched up. And we're not, you know, to protect the load, right? And but that's how we do it. Look how beautiful that suture line is. It is just incredible. Very, very nice surgery. And it is a pleasure for me to operate on this patient. She's a very sweet lady, and was a little nervous this morning. Mostly nervous not because of the surgery, but because of the IV, right? Because they usually have a lot of trouble putting that IV, you know. And in her, she has difficult veins, small veins that roll, and that sort of thing. So, but she is doing great, and look at that. See, so what we're gonna do. Let's get. So later on, when I take him out, I just pull him. It's like magic. You just all I gotta do is pull this, and that's it. Thank you. All right. So basically, the same thing we're doing here. We're removing the fat pads. There is 3 fat pads here on the lower eyelids. And you see these blood vessels, so we wanna like make sure that we don't leave any bleeding, right? So these blood vessels have to be electrocoagulated before taking this out. There we go. So that's one piece for the lower eyelid, okay? And this is another one right here. So I'm gonna isolate it a little better and remove it, okay? Thank you. So you see that everything that's yellow can be removed safely, right? But we don't want to, like I said, we can go crazy and take a lot of this fat out. You don't really need to take all of it out, just enough, right? So this piece is good, and then we'll check again, and if needed, we take more, okay? But that's how we do it. Thank you. So you see that everything that's yellow can be removed safely, right? But we don't want to, like I said, we can go crazy and take a lot of this fat out. You don't really need to take all of it out, just enough, right? So this piece is good, and then we'll check again, and if needed, we take more, okay? But that's how we do it. Thank you. And this one is on the side, you know. This one is, in her case, is very visible, right? The lateral one, okay? Okay, thank you. Wow, so she has a lot of excess fat, but you don't want to get carried away and be taking all this excess fat out, right? So you take whatever you need, but because if you take too much out, then it can end up with sunken in, you know. You don't want to be sunken in, right? So you want to take out whatever you need, but without sinking in, right? So because otherwise it'll have like what is called a cadaveric appearance, you know, where the eyelid is basically just like this. We'll take little by little. The eyelid is sunken in, and you know, then that's not good either. So we're gonna take some of this fat, but not a lot, so that, you know, and we do little by little is okay, instead of taking a whole bunch out, you know. And as long as this is yellow fat, we are good. I created a little trauma here. There we go. So this looks good like that. And let me see, this is a little bit of a, with this instrument I created a little trauma, you see? You have to be very careful. So we're gonna go this way and take this fat out as well. And yeah, you can put that Q-tip there. We'll just go over the Q-tip, right? There we go. Throw some fat out, you know. And see, this is the trauma I created with this instrument. So you gotta be careful not to, you know, every. And this is minimal. I'm exaggerated, but you know, just to let you know how meticulous we are and how careful we are. Thank you. All right. So yeah, you don't want any bleeding here, and so basically, we're cutting this excess fat right into the Q-tip, and we're very meticulous to the point of being ridiculous. Thank you. Okay, and so this is the lateral fat pad right here that we're removing. In her case, both lateral fat pads were very visible. You can see it in the outside, and I marked them. So that's the lateral. So we got all three fat pads out now, and let's look inside and see if there is any bleeding. I don't see any bleeding, very nice and dry, right? And on this other side, very nice and dry here. Look, see? No bleeding at all. So that's good. Thank you. So I'm gonna show you how dry this field is, right? This is some saline, right? Just to make sure there's no bleeding or anything, but look at that. Absolutely no bleeding, right? And so now let's get the let's get the scissors, iris scissors. And what we're gonna do is basically we're gonna basically overlap these. See, there's a lot of excess skin, but we don't want to take a lot out because we don't want an ectropion. In other words, we don't want her eyelids to be open, and she won't. We can always come back and do some more. So I'm very conservative when it comes to these. So we're gonna do some, but not a lot. So I'm gonna take these out, right? But notice how I am cutting with scissors, you guys, right? And yet there is, when I cut with the scissors, you can see I'm cutting with the scissors, yet there is absolutely no bleeding. How can that be, Emily? Incredible,
magic.
Huh? You see? Magic.
Wow.
Right? This is excess skin, not a drop of blood. Incredible. Thank you. And say again, we look inside, we do a little irrigation. There is absolutely no bleeding completely bloodless surgery, right? And then we're gonna basically mark the area, right? See, I had marked, this is a blue marking or purple marking for it. It's not a bruise, it's just a marking where I marked that excess fat that she had. And like I said, we didn't take all of it out, and so now I'm gonna overlap it a little bit, and you can see there is a lot, but I'm not gonna take all that out. I'm just gonna take a little bit, because the worst thing you can do is to take too much, especially in this area. Here you can be a little more generous in this area here, but notice how, I do these, and there is absolutely no bleeding, right? It's just incredible. Look at that. Incredible. Beautiful. Look at that. So that's the excess skin from the bottom. See, we remove, and absolutely no bleeding. Thank you. All right, so on the bottom, we don't do a running suture on the bottom. We just do interrupted sutures, right? On the bottom. But notice how close to the eyelashes that line is, and it heals absolutely beautiful. And these also do not need to be removed, because the upper ones do need to be removed. These ones don't need to be removed because these are absorbable sutures, right? So it's an absorbable suture here. This is another piece of the other suture. And this is an absorbable suture. So sometimes these knots may need to be trimmed, but we usually cut it right at the knot. And so just get the edge of the suture, the edge of the wound there, and approximate it, right? So that there is absolutely no bunching here, and the wound edges are just literally just kissing beautifully. See? Thank you. Okay, so on the lower eyelids, I do not put a continuous suture, but instead we do interrupted sutures. And these ones are, on the lower eyelids, are absorbable sutures, so they don't need to be removed, right? Because they're absorbable sutures. This other suture is non-absorbable on the upper, and I just pull it out. And I pull it out with my hand, just like I did that, and it is literally in a matter of seconds it comes out. We do that about 6 days or 7 days after the surgery. But notice how we do these in a completely bloodless manner here at the Cosmetic Surgical Center of El Cerrito. And this is just incredible. And this right here is the glove protector, right? It's eyelid protector, and we're gonna remove those at the end of surgery, which is almost, now I got still probably just one more stitch right there and it'll be done. Thank you. Okay, so now we're all done, so we're gonna remove her eye shields, and she's gonna close nicely here. She's a little swollen, but it's gonna close nicely. And then when we're done, we're gonna pull this in 6 days. Thank you.